Hi everyone, my name is Ashley, and I decided to make this channel to give information about being a surgical technologist and to document my journey through nursing school. So, like I said, I am a surgical technologist. I take my certification on December 15th. Here in my state, it is not required to have a certification. They just prefer it, but you do not have to be required like a lot of other states do. But yeah, so I do take that on the 15th, and if any of you have any questions after I take it, I can definitely share with you my thoughts on it, and also my study tips that I have to study for it. So basically, what is surgical technology? I am the person who's in there who is helping the surgeon while he is or she is performing surgery. However, a lot of people can think that, oh, you're just there just to pass instruments. You're not. You're there for the whole entire duration. You're there for everything. If one thing goes wrong, you're there to help fix it. And hopefully you're not the reason why it went wrong. But it's a very interesting field. It's something that you kind of have to build a thick skin for, because I've been in the OR where a surgeon threw a pair of scissors, like just threw them, and I'm just like, oh, thanks, I guess you were not going to use those anymore. And also I've been in situations where a surgeon has slammed scissors on my Mayo and broke them because they were not sharp. And you have to have a thick skin, like I said, because they will try to chew you up and then spit you out. But if they see that doesn't affect you, then they stop. They just get over it and move on with their lives. But you are one of the most important person in the room, because without you, what are they gonna do? I can't tell you how many times I've been in surgery and I've had a doctor say, "What do I use for this?" And I'm just like, excuse me? Like, really? Does your patient know that you're not there? But there's been times where, I've had to guide the doctor. I've had to take in a skin marker and draw on the drape little anatomy to show, like, okay, you don't want to go here, you want to go here. And it's scary sometimes because you have to know your stuff. You have to know your anatomy. You have to know everything, because just one wrong snip, and unfortunately that's how accidents happen, that's how deaths happen. I'm not saying that all deaths happen because the doctor doesn't know what he's cutting, but it happens. Hasn't happened on my watch in my room, but it has happened before, because I've read many different articles and stuff. So let's see, what made me want to do surgical technology? I did not know what a surgical technologist was. No idea. Didn't even know they even had a name for somebody who is in the OR with the doctor doing surgery. Now, you are not doing surgery. You are not cutting. You are not suturing. You're doing none of that unless you are a first assist. Then you can suture. I'm not sure about making an incision or anything, but usually you have residents in there or med students. And they will tell you, oh, I'm a resident. And you're just like, go pull your gown and your gloves. It's just move along. And they're really, the residents that I've been with, they're worse than the surgeons, to say the least. They get a little snippy, and you just kind of have to politely and respectfully put them in their place. You have to be very, very vocal in this field, because if you're not, like I said, they will just chew you up and spit you out and ask if you want to go for round 2. It's terrifying at first, I will tell you. My program was almost 2 years long, close to 2 years, and the last year was the hardest for me, because like your first year you pretty much just take your prerequisites, like your Englishes and your maths and all that stuff. Your anatomy and physiology and your microbiology, you take that. It's considered your prereqs, at least at my college it was. Then you get into your core classes, and we took like intro for surgery, the lecture in the lab, pharmacology, procedures 1, lecture in lab, procedures 2, lecture in lab, and then you hit your clinicals. Clinicals it was a beast for me. It really opened your eyes up to what you're going to be doing. Luckily, we got to do observations prior to going to clinicals, so you got to see like, okay, is this really what I want to do? Do I really want to stick this out? Because a lot of people have misconceptions of what it is. I mean, I've heard students at my school who were going for surgical technology, but they were in the very beginning stages, just taking like their maths and their Englishes, and I overheard one student talking on the phone saying, oh yeah, my major is surgical technology. Basically what I'm just going to do is go in, set up the instruments, and then leave. And when she got off the phone, I had to say, look, I'm sorry, like I listened to your conversation, like bad manners on my part, but that's not what you do. You don't just set up and then leave. And she was just like, what? And I'm like, yeah, no, you stay there for the whole entire surgery unless you have someone who can come in and give you a 30-minute, 15-minute break. Then you go right back in. And she had no idea. So I would definitely say do your research before you decide to go into the field, because there's a lot of misconception of what you do and what you don't do. I'm trying to think of what else. We had to do, I go to a school where it's an accelerated program. We only have 8-week classes, so we don't get the traditional 16 weeks like normal colleges do. We just get 8 weeks. So for our clinicals, it was a full 16 weeks, but if you didn't pass the first 8 weeks, you don't move on. You have to wait until the next round comes around to go back to clinicals. Our clinicals were Monday through Friday from 6 a.m. to 3 p.m. If we wanted to, we could stay later if we wanted, but really by the time 3 o'clock rolled around, I was like, okay, I'm ready to go home, because I had to work after, because I also worked full time. So that was really hard. And that's another thing. If you do have children or you work full time, you have to make time to study, because you have to study, and it's something that you should want to study, because you have someone's life in your hands. It's not, like working on a car, not knocking that at all, because I have a whole line of mechanics in my family, but it's not something that's so replaceable as a car. You have someone's life in your hands. They're on the table right in front of you. So you have to study. You have to know your stuff, because, I mean, if one thing goes wrong, you have to think quick like that to think, okay, what can I do now? What should I do? If you have a bleeder, you can't just freeze and like, oh crap. You need to be able to think quickly, like, okay, do you need hemostat? Let's give you a hemostat. Let's try to clamp that bleeding off. Let's try to do something to stop the bleeding. Which is really, like, you have to know. Like, there's been so many times where, a patient will just was bleeding and bleeding and bleeding, and you have to be able to control and compose yourself to know what you need to do, what you need to give the doctor so you can stop that bleeding, because it's no joke. I mean, a person can bleed out so quickly, and it's scary, but it's also exciting in a way. Not that saying, someone bleeding out is exciting, but it's almost like a rush, because when you get that bleeding to stop, you just think to yourself, oh my God, like, I just helped do that. I just helped save this person's life. It's a wonderful feeling. It truly is. But yeah, for our clinicals, like I said, they were 8 weeks, so full 16 weeks, 6 a.m. to 3 p.m., Monday through Friday. And how my school set it up, we did 3 weeks at one hospital, 3 weeks at another, and then 2 weeks at another hospital. And each 2 weeks we had different rotations. So like 2 weeks I would have general, and then 1 week I would have like GYN. And then 3 weeks I would have neuro, and then 3 weeks I would have, I can't even think right now, plastics. So it went 332, 332. Let's see, my least favorite rotation was ortho and neuro. I can't stand ortho. I cannot stand neuro. A lot of people think neuro is like, oh, your brain. No, it's not. It is your brain also, but it's also your spine, and it's a doozy. That's a doozy. Ortho is just, it's orthopedics. It's with bones and things like that. A lot of people get confused with ortho and podiatry, but podiatry is, your feet and everything, and that can involve bones, but it kind of depends on your facility, because I've had some facilities where they call it ortho, other facilities say, no, this is strictly podiatry, this is not ortho, don't even call it ortho, don't even think about it being called ortho. My favorite rotation was plastics. I loved plastics. It's just amazing what a doctor can do. They can sculpt a person to look completely different, and it's amazing. And I dealt with a lot of, for my plastic cases, a lot of them were women who had breast cancer, and they were cancer-free, and they unfortunately did not have their breasts anymore, so we did implants. So that was very, very rewarding to see, because, when that person wakes up, they're gonna feel a little more better about themselves. Because that's a very big psychological change that goes on when you do lose your breasts due to cancer or any reason. And also, my other favorite was labor and delivery. I loved labor and delivery. The C-sections, you have to be very quick, because, the mom can bleed out in an instant. You have to make sure you get the baby out, you have to make sure you get the cord blood, you have to make sure you deliver the placenta, but then you need to make sure that you stop the uterus from bleeding, and it's so much going on, but it's so exciting. It's so awesome to bring in a new life, So every case that I had, it was just a good day. You also have your bad days, so that's one thing that you have to think about, because there will be deaths. Death is inevitable. That's the only thing that you're promised in life, is death. So you will have deaths, and especially in the labor and delivery department, it's difficult, because you deliver a baby and the baby isn't alive, and it's a very heartbreaking, unfortunate thing. But you have to be able to put yourself out of that, not think about it, and you cannot bring it home with you, because I unfortunately did have a death in the labor and delivery department, and I was upset, because it's heartbreaking. It's something that I can't explain, and I cannot even begin to understand how the mother felt. I don't even want to begin to understand, because that is just too heartbreaking. And I do hope that she's doing better, and I hope that she's coping well, but that's something that you have to also accept. You have to accept death. Because it'll always be there, especially in surgery. So that's pretty much it that I can really think about that. If you have any questions, or if you want me to talk about anything specifically, just let me know, and I'll make another video. I hope to be doing this a good bit. I also start in January. I have 4 prerequisites to take before nursing school. December 4th, I take my nursing school entrance exams to the HESI. I don't know if that's all over the U.S. or if it's just my state, but it's called the HESI. I have to take that on the 4th, and I think I'm going to pass it. I know I'm going to pass it. And then I apply in January 15th, I believe, for nursing school to start in the fall, so I'm hoping that I get to start that, and I'm definitely going to be documenting my time through nursing school, because that's going to be a doozy also. So if any of you have tips, if you are in nursing school, or if you know someone who's in nursing school, please send them my way, because I'm going to need all of them that I can get. So I think that's it. But yeah, if you have any comments, questions, or anything, just let me know down below, or you know, we'll see where this takes us and takes me. And I hope you all are having a good day, night, evening, whatever it may be while you're watching this. All right, bye guys.